Yes, I'm hearing you. Can you hear me?
Yes, I can hear you.
All right, great. Okay, please tell me a bit about your NCLEX experience.
Ah, it was a bit rough. Maybe I rushed into doing it, but I had booked my exam May 2028, and
Okay.
then a week before, 2 weeks before the exam, I became sick.
So
So
sorry.
I postponed it to June 6th. So I did first after being sick a week before the exam. I was like, let me do revision. I was using UWorld as the college recommended. We stick with UWorld. So I did my review. I did everything, and then I was getting high
Okay.
in terms of my assessment. I had 6 assessment. So all the 5 assessment I was getting borderline. So I was like, maybe I should not do it. I should continue my studying and then I did my last one and it said hi, and then that made me to go do it, not postpone doing it.
Yeah.
So I went do it. I just felt like by the time I reached 85 question, and then it went to 86, and I went until 150, and I just felt I was not doing good. By the time I was 85, I felt I was not doing good. I even felt maybe it might shut me by 85 question because I'm not doing good. And then I just like, okay, the question's still coming, still coming. So it went until 150. And still I was just like, I don't think I've done good.
Okay.
Yeah. So
I understand. Right. Now, this is it, right? Let's start with the program, right?
yeah.
Now, one thing I always used to tell students is this, right? Program, most especially this question bank program,
Yeah.
don't help you to pass the NCLEX exam. Right. It's the knowledge you have that help you to pass the NCLEX exam. If you
Yeah.
subscribe to any question bank program and you end up passing the NCLEX exam, it means you could have passed that exam even without the question bank program.
Mm-hmm.
You only needed a particular question bank to make you feel the NCLEX, to make you see what the NCLEX look like.
Yeah.
And then you depend on maybe a particular percentage to show that yes, you are ready to take the NCLEX exam. Now, if student feel question bank is the one that make um everyone to pass the NCLEX exam, guess what? In nursing school, everything we're supposed to be doing in nursing school should be related to what? Question bank.
Yeah.
Semester one question. What we should just be doing is just question, question, question. We don't need
Yeah.
any knowledge, just question.
Yeah.
But it's not what question that what help us to pass the NCLEX. Now, guess
But
what?
how the college made it, like it was compulsory to get it. Like it was no question about it. It was compulsory to get it through the college.
Mm,
So I just believed, okay, this is what will really get my knowledge and understanding of the questions to do my exam.
exactly. Yeah, I understand what you are saying now. This is let me explain something for you. Nursing school give you the knowledge. Can you see my screen?
Yes.
Nursing school give you the knowledge you need to attempt the NCLEX exam, right? To become a nurse. That is how it works. Now, question in nursing school. Just recently, most nursing school in the US started changing their way of answering question, asking question. I mean, previously, before it's always strictly level one, level two type of question, right? Which all deal with street knowledge. Like it just recently school started doing what application type question similar to the NCLEX. Before it was not so. So that is the main reason why they want you to fill the application type question of the NCLEX. They compulsory a particular program that tests something similar to the NCLEX for you to be able to attempt. But the truth is this, without that question bank, you can still pass in as much as you have the knowledge. Because NCLEX is testing the nursing school knowledge you have to see if you can practice. Now, the problem is that a lot of students pay attention to the question bank. Instead, they don't pay attention to themselves, the role of them being what? A nurse. So when you go on the NCLEX exam, you 100% feel the particular question bank should save you. Now, on the NCLEX exam, instead of that, you meet confusion because you don't know what to do if you 100% believe. Now, those people that survive it are those set of people that have that initial knowledge that they're able to like pick up that understanding from the question and they end up what? Passing. Now, I am glad that you said you were I like I've seen students, right? Not you said you would, right?
Pardon?
You said you use you would, right?
Yes, I used UWorld, and then a friend of mine told me to try Mark Clement. She passed. She told me she concentrated on Mark Clement. So I did all Mark Clement videos, review, and I did like 2000 UWorld, all my 2000 and something
Yeah.
UWorld questions here.
Okay. All right. I will still come back to the word. Now, this particular student I'm talking about, she have 90% in boot camp, not you. This is boot camp. And she
Mhm.
still ended up failing the NCLEX exam. This is somebody that I know that was very what? Smart. Now,
Yeah.
when she took her second attempt, she passed, right? But what made her to fail the NCLEX exam was that when she went on the NCLEX exam, despite the fact she have this 90%, right? She don't understand what the question is asking. Like I said, when you were on the NCLEX exam, it was not really about maybe you did not do well in your 2000 question, but it's because when you went on the NCLEX exam, it looked like a different environment. It looked like something you've not seen before. Because some questions don't look clear to you. Sometimes you don't even understand what the
They're
answer is
asking.
trying to
Then
test you,
there's,
something like that.
yeah, there's so
Now,
much information. I was like, whoa.
okay, great. Now, now, let me tell you something. You what is good bootcamp. All these programs are good resources. But if you don't understand the NCLEX exam, guess what? If you are not up to some certain, because all of us might be in a class together, and we are going to have 10 in a particular test, but you don't know who struggle to have all the 10 marks. Some people easily have this 10 marks, some people struggle to have this 10 mark because all of us are not the same in our thinking, right? But we try as much to like get a particular result, right? Now, so if we go on the NCLEX exam, right, the way student A is thinking might be different from the way student B is thinking. If student A thinking is matching the way the NCLEX wants them to think, they end up passing, right? Now, if student B thinking is not matching what the NCLEX wants them to think, they end up failing. You can easily pass bootcamp, what are they calling? Question bank, you what question bank, and every other question bank because the question might be written in form of application, but the answer keys are not written in form of what? The way NCLEX wants answer keys to be written. That is the problem a lot of students don't understand. The answer key is not written in form of what? The way NCLEX wants the answer keys to be written. And two, the body of the question is not written the same way NCLEX wants the body of the question to be written. NCLEX wants you to do two things when you see a question. One, NCLEX wants you to have the ability, before you attempt the NCLEX exam,
Yeah.
right? You need to know the content. Before I even talk about this, now let me ask you: when you were doing your question, obviously 90% that's a very. If you said I, right? That is a very good range to be, right? That they will tell you you are ready to take the NCLEX exam. How many questions related to you? What did you see on the exam?
Mm, maybe one.
One. So
Yeah,
that
I
is
think
one.
I
Oh,
saw a question that I saw on UWorld. One question, yeah.
right. So that is 1/150 questions. Right. Because
And
the reason I'm asking, right, is because a lot of students believe they want to say if you go on bootcamp group right now, like Facebook group, you will find out that a lot of students are asking this one question: which program have exact same question as the NCLEX, because what they want is to purchase that particular program, go on the NCLEX, see that particular question, and be able to answer it. People don't want to even do the work again. Right. I understand a lot of people struggle in nursing school. They want easy way out and they want to pass, and that is it. But the truth is, there is a way out. No, there's no easy way out. That's the main reason why you don't skip nursing school and become a nurse immediately. Right. Because a lot of people bypass their way in nursing school. You need the NCLEX because you cannot bypass this. Right. Today I saw somebody giving up. I saw somebody giving up. Right. Says she's no more willing to do the NCLEX again. The whole workload is too much. It's breaking her mentally and all that kind of stuff. Right. The problem is always the foundation. How did you right and do nursing school? It's the foundation. Because NCLEX is not testing about anything different. NCLEX is only testing about what you know in nursing school. But guess what? You are all over the place, and that's what is causing problem. There's a clear path to success, but a lot of students don't follow it. Now, NCLEX wants you to know the content. When you were studying for content, or I don't know if you ever studied for content, what did you use to study your content?
I just use the textbooks, the textbook the college recommend, and the notes the lecturers give us in class.
Okay. All right. Now, as I said, right, when NCLEX, like now I say, no, these are how NCLEX want you to see your question, because it's like here, just like putting you in a particular room with a particular client, and then the person that brought you to the room now started telling you something about the client, and they're like, oh, your client is so and so, this and
Yeah.
that. Now, what would you so and so to the client? A, this, B, that, C, you understand, D, and they gave it to you like that. Now, first thing is that NCLEX is not directly giving you what the client is all about. Instead, they want you to critically think based on information previously given to you. What is
Yeah.
wrong with the client? So that you can be able to apply the question NCLEX is testing you on that particular situation, and then be able to critically think through the answer. Now,
Yeah.
the problem is a lot of students don't know that nursing school question is different from the NCLEX question.
Definitely. Yeah.
NCLEX question, the body of the question contains your content. The stem is your examiner question. Now, the answer keys, right, which are your options. The way NCLEX writes the answer key is this. NCLEX will think about misconception in nursing related to that particular content. And they will try as much as possible to make a correct answer look correct, to see if you can find out what is incorrect in that particular answer. But guess what? A lot of students are not used to that because that is not how nursing school writes the
Yeah.
question. So
Yeah.
due to that reason, we are thrown away because this is it. In nursing school, if take for instance, nursing school is writing a particular question like this now, and this is the answer key. Nursing school can tell you, like, okay, let us say we're about to do blood transfusion. Blood, let me write it in full. Blood transfusion. Now, and then one of the answer is verify with another nurse, right? Now, maybe two, a particular answer, three, a particular answer, four, a particular answer. Now, this is how nursing school will set question. Now, you cannot deny the fact that this is a correct answer related to what? Transfusion. That is what nursing school. Now, look at how NCLEX sets question. You can see, you will see what I'm saying now. Now, this is what you are used to because this is what you've been doing for maybe 2-3 years in nursing school. Now, look at NCLEX. NCLEX, same question, blood transfusion. But now, guess what? This is it. One, verify with another nurse using client room number. Then you have option 2, 3, and then option 4. Now, tell me the difference between this answer and this answer. Tell me the difference between this NCLEX answer and this nursing school answer. NCLEX answer is saying verify with another nurse using using client room number. Answer 2 is talking about verify with another nurse, just like that. That is for nursing school. So tell me between the difference between the NCLEX answer and the nursing school answer.
Yes, I see the difference. There's some trick with the NCLEX because they've added something that is not right, room number.
All right, great. Now let me tell you something. You spot out this room number, right? But
Yeah.
guess what? 90% of students don't spot this room number. Because the way 90% of students think, I've been coaching for the past 2 years and I've seen this many times. Right. I stopped doing that test. That was last year. I will just pick up a particular question. I will like give it to students. And then the students will see the question, right? And they all like it's only just one student that spotted it and was like, oh, that answer is not going to be correct. Just one student out of maybe 50 students. So automatically I can easily know this is the problem because obviously 50 one student out of 50 students just spotted that. It means that this is how we think it, we still think like nursing school students. Because nursing school don't give you problem with your answers. It's the question that might start the problem. The moment you understand the question, the answers don't give you problem. But you don't know that in NCLEX don't only give you problem with the question, it will also give you problem with the answers.
Yeah.
So that is the problem. Now, when the students saw verify with another nurse, right? Most students have short span. They don't even want to read something completely. That is number one reason for failure. They don't want to read anything completely. They automatically just believe, oh, verify with another nurse. Yes, yes, yes. We do that during blood transfusion because in nursing school, you don't question your answers. It's either correct or wrong. But on the NCLEX, your answer is a way of NCLEX testing to see if you are a safe nurse. So you don't just see answer and just accept it. You need to ask yourself, is there anything in this answer that make it incorrect, despite the fact it look correct or is written in a form that it is correct? That is how the NCLEX work. Now, I was telling that student, there was a particular student, right? I said the answer is not uh verify with another nurse. She said, I swear my lecturer told me this. I swear I read it in a particular program. When I was talking to her, I was on Zoom, right? I was hearing her like opening a particular note or maybe textbook. I don't know. The next thing I saw was a particular image that she sent to me, confirming to me that we verify with another nurse. I said, Shana, please pay attention to this question. Read it again. This time around, read it completely and tell me why that is not the answer. She said it's the answer. She read everything through. Verify with another nurse using the client room number, and she still said it's correct. I said, is it correct? He said it's correct. I said, you are focusing on we verify with another nurse during blood transfusion. But NCLEX is testing safety related to what? Client identification. When you are saying verification with another nurse, NCLEX is saying client identification in that question. How would you know that it's possible for NCLEX to test client identification in blood transfusion question? It's because client identification is part of NCLEX content. NCLEX can decide to test anything in a particular answer key. If you want to give medication, you will confirm client identification, right? If you want to do a particular procedure, you will do client identification. So in nursing school, if NCLEX is testing about blood transfusion, NCLEX might not even put anything related to, nursing school, if nursing school is testing about blood transfusion, nursing school might not put anything related to client identification in your question. Every answer might just be related to what? Blood transfusion. But NCLEX, it's nursing. Reporting to the doctor might be related. Stopping transfusion if there's any kind of reaction might be related. Like anything in general. Even keeping the client's information confidential during blood transfusion might be related. Consent might be related. It's a mix up of care. Nursing school will pick a specific topic and test you on that specific topic only. But NCLEX don't pick a specific topic. One topic might test 5 different information, because NCLEX is not testing you as a nursing school student that want to verify specific knowledge. Instead, NCLEX want to verify that you can practice. So if you are going on the NCLEX exam, right, you want to go on the NCLEX exam because you feel you should start feeling like what? A nurse. So anytime you are reading your question, right, always ask yourself, I am the nurse in this question, or who is in that particular question? Because now there are 3 people that NCLEX always used to describe in a particular question. Is it that NCLEX is describing you, the nurse, or NCLEX is describing a staff member, or NCLEX is describing the charge nurse? So you need to know the staff member, the nurse, and the charge nurse. The duty of the charge nurse. Charge nurse will delegate tasks. They will assign tasks, right? You as the nurse will fulfill the care, right? And you as the nurse will supervise what? Staff member. So you are going to observe, see what the staff member is doing wrong. You are also going to delegate as well too. So these are your duty as a nurse. So pay attention to what the NCLEX is saying. Sometimes NCLEX might say a pregnant nurse. Guess what? Why is NCLEX describing a pregnant nurse? NCLEX is describing a pregnant nurse because there's something specific about that nurse. Because on a normal day, the duty of a nurse is what? To care for the client. No one cares about the nurse. So, but this time around, NCLEX is saying a pregnant nurse. It means NCLEX wants you to pay attention to the nurse while you're also paying attention to the client. Because there's something about the nurse. That's why the NCLEX is saying a pregnant nurse. So you always need to know your role as a nurse. When you are working as a nurse, you have staff member, you have your charge nurse, you have doctor, right? You also have other team members as well too, right? Your occupational therapist, your the pharmacist, right? You have your physical therapist, speech therapist, dietitian, nutritionist, a lot, social service. Everybody is part of what? The care. So NCLEX can direct you into different area of care. NCLEX can direct you to another unit to start thinking communication, documentation. All these things are part of care. So how do you put all this knowledge together in order to pass the NCLEX exam? That is what a lot of students don't know. A lot of students think it's about 200 disease condition. A lot of students think it's about knowing pharmacology, and no, NCLEX might give you a question related to pharmacology and it will not even be related to testing you about pharmacology.
Yeah.
It might be testing you about a different thing. NCLEX can test you pharmacology and test you polypharmacy for adults. NCLEX can test you pharmacology and test you on how you administer a certain medication.
Yeah,
Instead of you testing
I I came across all my pharmacology questions were not like when I was studying about pharmacology. I was just like, what is the drug? What does it do? What are the side effects?
yeah.
So when I got to Netflix, when I was getting my pharmacology questions, they were like showing me like on the skin, this rash is related to which medication. So I have the list of medication. I'm like, okay, this rash, I'm just like,
You see how NCLEX
I'm
work.
just like,
NCLEX
I'm
want to
like
see if you are a safe
stranded now. This rash is for which medication? So,
Yeah, NCLEX is trying to that particular question. NCLEX is trying to test you on which medication will cause allergy. Because if you give a particular medication, you see rash, then it's a reaction or adverse effect to a certain medication. It can be allergy. It can be maybe another thing that can cause rash like that is if you are giving vancomycin that cause
yeah,
pain.
it was all antibiotics
They were all
options.
antibiotics, right? So
Yeah,
antibiotics is
and
big,
then so
big
what
for
showed
allergy.
me off was like, whoa, now I have like a real rash. Like, okay, well, so like now my head is like, oh, okay, now that's not how I studied. Like, I was not literally knowing which rash is from. So that really put me, and it
Yeah,
looks so simple question. It's like,
yeah, it's
okay.
definitely a simple question because obviously 100% I can guarantee you that question is testing you about allergy. Right. So the main allergy medication is your penicillin. So what I would have been looking for is the antibiotics medication related to what? Penicillin.
Yeah.
Right. That's what I'll be looking for. because that is only what can cause allergy. Yeah, if it is like a peel of the skin, then I'll be looking for vancomycin, right? Because
Yeah, it was like a ring with a dot in the center, like this rash had a dot in the center, like a tick kind of
mm,
rash.
okay,
How the tick. Yeah, so that, like, my point was, like, as you're saying, how the NCLEX test was totally different with what I was getting
exactly. That is the
studying
reason
using
why we
program.
need to be used to the environment of the NCLEX. The moment you are used to the environment of the NCLEX, right, you are definitely going to pass. Trust me, I've seen this, right? People that most times I will feel like it will take them more time for them to understand everything about the NCLEX and pass. They successfully pass the NCLEX exam. So NCLEX exam is not difficult, right? It's just your approach towards it, the way you are understanding it. That is the main reason why I decided to be an NCLEX coach, because I want to be able to walk a particular student through, see where they are doing it wrong, see where they're having their thinking wrong, see where they're having their approach wrong, so that I can guide them through.
Yeah,
Now,
before even my first exam, I saw your videos, and then I was just like, huh. So I didn't completely finish the video, but this time after failing, I was like, let me. I was like, okay, I think I should listen to his. So that's why, like, last night I like watched a whole video
video. Oh, okay.
until the end, and then just how you're breaking down on how to understand
Yeah.
and it was making some sense to me, and I'm like, okay, maybe I should try you as a coach and see if it can help me next, because at where I'm standing, how I feel is like I'm stuck. Like, I have two young children. The last 2 years, like my husband has been carrying the family in terms
Yeah.
of financially, and
Mm.
and now I'm stuck by failing. We can't move on, and I'm just like so stressed. Like, I just need to get this done so I can help him in terms of picking up the family.
Yeah.
And yeah, so I was just like watching the video last night, and I'm like, maybe I need someone to guide me on how to go do this.
All right, for sure, definitely, I can 100% guarantee if you do the work, you are definitely going to pass, right? The NCLEX is not difficult. I'm definitely going to guide you. Now, let's talk about your journey real quick. NCLEX versus, I've told you about nursing school NCLEX, but I'm just going to like recap a little thing. Now, there was a particular point in time you were thinking of becoming a nurse. Now, you needed a nursing school program. You
Yeah,
need to pass the NCLEX in order to what? Become a nurse.
yeah.
Now, I always used to tell students this. There are two things that will make you a nurse. Your nursing school program, the NCLEX, they make you what? A nurse. Now,
Mhm.
nursing school program tests you related to knowledge-based question. NCLEX tests you related to practice-based question. Nursing school offer you different courses, right? But NCLEX offer you a practice environment, because NCLEX wants you to start practicing as a nurse even when you are not yet a nurse, to show that you are ready what to become a nurse, right? Nursing school give you the knowledge to pass the NCLEX that give you the license to become a nurse. So this is the approach. So what is stopping you from becoming a nurse right now is the NCLEX. The moment we fix the NCLEX problem, right,
Mhm.
everything all come in place. Now, so that's the transformation you need right now in
Yeah,
passing the NCLEX exam. Now,
yeah.
you have three things that you need to complete in order to pass the NCLEX exam successfully.
Mhm.
Right. The reason why I always used to say you need to pass the NCLEX exam successfully is that a lot of students pass the NCLEX exam, right, but they struggle through it. But if you don't want to struggle, you want to pass successfully, then you need to focus on these three things. It's always these
Mhm.
three things that make students to fail. One,
Yeah.
content, not knowing how the NCLEX writes the question, and the inability to understand the question. Right. This time around, I want you to finish a 60-day program and go on the NCLEX exam and let the NCLEX look like a practice test to you. I want you to ensure you see every question and you understand it. But this is how it can happen when you know the content. Now,
Mhm.
NCLEX knows something about you. NCLEX know you have all nursing school knowledge. So NCLEX just wants you to do two things. Use this knowledge to show that you can practice, and also use this knowledge to show that you are what? A safe nurse. And how do you do that? One, by paying attention to the 8 client need. Now, how would you go on the NCLEX exam? You don't know the content and you want to know about each client. It's not possible. Just like right now, you cannot start giving a patient medication without not knowing their diagnosis. That is not good. Right. So if one is going on the NCLEX exam, you need to know the 8 client need so that you can know the practice area, you know the 8 client need, and then you know the content. Now you are taking the RN exam. RN exam have 146 content. So this 146 content now gives you an idea of what the NCLEX will test in your 85 question. Now, passing in 85 question and passing in 150 question is not a problem. Or getting to 85 and you start having 86 to 150, it's not a problem. A lot of students pass within 86 and 150 question. It's not because of you were not doing well. Trust me, if you were not doing well, your exam will stop in 85 question. You were doing so well. That is the main reason why NCLEX gave you the opportunity to proceed. Not everyone have that opportunity. Most people, their exam just stop at 85 questions. Now, guess what? This is how you should think about it. Now, if NCLEX make you to fail the exam in 85 question, meaning you have to wait another 45 days, you need to pay another what? 200 what? Dollars. This is a stress on its own. But instead of the NCLEX making you to wait and paying another $200, NCLEX gave you the opportunity to see if you can still pass within 86 to 150 question. Right? That's what NCLEX did to help you out again. So that this is like another exam. So to me, I call it another exam, right?
Yeah.
Because the first one is 85. Right? The first question is that you got on the NCLEX exam. That's the first part. That's the minimum that you can
Yeah.
get, 85. Now, the next set of questions that take you to 150 is 65. So after this, NCLEX made you to attempt 86 all the way to 150. So that is another 65 questions to still show that what you are a safe nurse. But unfortunately, it happened that you did not get the result you desire. But right now, I can tell you, yes, you are in the right spot and you are going to definitely get that result you desire. At least if you failed in 85 question, I would have been saying, oh, you need more work to do. But you failed in 150 question, shows that you know some stuff. I just need to help you with little lift and you pick up, and then what? You start understanding. Now, two aspects back to the two aspects. We
Yeah.
have the 8 client need and we have the safety aspect. The safety aspect is all about the SAFE concept. Now, when NCLEX think about a specific content that they want to test you on, they think about one's concept to test you because the concept determine what? The concept is how the NCLEX determine if you are a safe nurse. Right, because all this concept is what you are going to utilize when you are working as a nurse. All these concepts. So the NCLEX way of thinking about it is this. If this concept is what this nurse will use when they are working as a nurse, let us see how they can apply all this concept to show that they are a safe nurse. So everyone knows that if they start working as a nurse, they are going to meet a patient with hypertension, they are going to likely take care of a patient with diabetes, they are going to likely take care of a patient with COPD. Everybody knows this. But the real question is, if you happen to see a patient with COPD, do you know the vital care that they need? That is how NCLEX think. Do you know the common mistake that a lot of students make during practice? That is how NCLEX think. So NCLEX don't hide content. NCLEX even gave the content. It's on the test plan, the content, and that's 146 content for RN. So the moment you complete those contents, now you have the ability to know every single question on the exam. Even when the question is going higher in level of difficulty, you have the ability to know every single one of your question. Now, the only thing NCLEX is just expecting from you now is to understand the concept at which NCLEX is testing and be able to critically think through the answers and give them the right answer related to what the NCLEX is testing. Which brings me to how the NCLEX look like. NCLEX question every NCLEX question have 3 parts, right? You have the body of your question, you have the stem of your question, and then you have your answer keys. Now, your body of your question contain the content. So now when you are done with the 146 content, you've studied everything. Now the next thing you want to start understanding what? The stem. Because the body of your question might look like this, right? 1, 2, 3, 4. Now, this part is the body of your question. If you pay attention to the body of your question, you read it carefully, you are going to find out that NCLEX is testing you on a specific thing. You'll be able to start understanding and say, oh, this is what the NCLEX is testing me. Now you've locked in the content. Now, next is for you to read the STEM, which is the examiner question that is testing you something related to that content. And then you start breaking the answer key one after the other. That is your answer keys, right? And then you finally get what? Your answer. Now, there's an advanced way I think about the answer key. Answer key has the ability to give you extra understanding of what the body and the STEM is asking. So when you get fully into the course, you definitely would understand that. Now, when you were doing the NCLEX exam, you never used the test plan.
I didn't use the test plan. I
Okay.
didn't even look at it. I was like, this is too much.
Wow.
And then it didn't, like, I just perused through and then I'm like, I don't think.
All right. Now,
No.
let me explain something to you. There was a particular student. I don't know if you've heard me always saying it. She failed the NCLEX exam 14 times. Now, she will pay at least minimum $200 for retake. So let us say 14 times 200. That is 2,800, right? Dollars that she paid. Three of us, $2,800 that she paid. Now, over 146 content. So which one is too much to you? This money or studying this content?
Money is too much.
All right. Because not only the money is too much. To me, I feel like the money is not even too much. Now, funny enough is that she have to wait 45 days each time she failed this NCLEX exam.
Mm-hmm.
That is one. Two, not only that, she have been disappointed 14 times. She have a delay career, right? During this period of time, she could have been working as a nurse, living the dream life she wished for herself, helping herself. Like now, you are saying, "Oh, I want to help my husband financially, this and that." Right? The right now you are unable to do that because of now there's a delay. Unable to pass the
Yeah.
NCLEX exam. So that is what is so much. The content is not too much. If there's one specific thing you can do that will guarantee you a pass, trust me, I don't know about you. Me, I will go all in for it. When I was studying for the NCLEX exam, I had 300 content, another 146 content, right? RN, then 200 disease condition. Altogether, I studied like, if you do the maths right here, you are going to get 646 content
Mm-hmm.
in order to like really. And not only this, I studied 251 question. I did not use question bank or all that kind of stuff. I used NCLEX past question and all that kind of stuff, right? And I did analysis of 1940 past question from the NCLEX again. So this was what I did, right, in order to pass, because I knew I need to get this. So if there's a clear roadmap that guarantee you getting something, right, me, I would definitely go for it. I definitely know that I'll go for it. Right. So
Mm-hmm.
too much is failing the NCLEX exam. Too much is delay. Too much is having to feel like you are not caught for nothing. Too much is when you attended in nursing school after all your investment in yourself in nursing school. Now there's
Yeah.
nothing to really show for it. Like the NCLEX is making you fail multiple times, and then you feel like you've wasted everything. And you understand,
Yeah.
you feel like you are not moving. That is too much
Mm-hmm.
for me. So 146 content is not too much. If it guarantees you a pass, why not go for it? Now, so that's how the NCLEX works. Now, let me show you the test plan real quick so that I can explain something. I will stop this sharing and share the test plan document. Can you see my screen?
Yes.
All right, sound good. Now, let me go straight to the content area. Now, this is the content, right? These are the 8 client needs that we have right here. So we have 1, 2, 3, 4, 5, 6, 7, 8. Right. So each of these 8 client needs, they have their content. So If you add up all their content together, it gives us what? 146 content altogether. Right. So, but there's one thing you need to know about each content. They have a certain percentage, right? You can see it, a certain percentage. Now, what I always used to do with students is this: I pay attention to the area that have what? The most percentage on the exam. If you add 18 plus 13 plus 16 plus 12 plus 14, that will give you 73% of the exam. Imagine having 73% of the exam, right? You definitely will pass the exam. If you have the knowledge, right, related to this 73%, you pass. Now, this other 999 area equals 27%, right? Now, a lot of students will say, "Oh, I struggle with maternity. Maternity is health promotion. I struggle with pediatric. Pediatric is health promotion. I struggle with pharmacology. Pharmacology is 16%. I struggle with med-surg. Med-surg is 14%. Let's do the math together. That is 39%. Can 39% help you pass the NCLEX exam? Obviously, no. Because in order to pass the NCLEX exam, you need 60%. Over 100% of the O exam. Now, guess what? In my coaching program, I offer you what? 75% knowledge. That is far way above what you need to know. And then you are able to pass easily. Right, but 39% cannot make you pass. And look at the area I just mentioned. If you ask a particular student now, what do you struggle with the most? They will say, I struggle with med-surg. What do you struggle with maternity? What pediatric, pharmacology? All right, everything you struggle with the most is 39%. Now, a lot of students feel like they are studying everything they need to study, but according to the calculation of the NCLEX exam, it's not enough for them to what? Pass the exam. So that's the reason why people feel overwhelmed, that they study a lot of things and they don't pass. They feel frustrated and all that kind of stuff. But do you think NCLEX is testing you on everything under maternity? Hell no. Do you think NCLEX is testing you on everything related to med-surg? No.
No.
Pharmacology? No. There are specific things. That is the main reason why the content is important. Because in nursing school, you did more than 146 content in nursing school. You did thousands of content in nursing school. But NCLEX just want to test you on specific content that are related to practice as what? A registered nurse. That is the reason why the test plan content is important, and you need to know the distribution of the content, because you cannot just say, okay, now I know where to study, and you just want to study like that. You need to study according to the flow. You need to study according to what? The distribution. These are the distribution right here. This 18%, meaning management of care content, we have the most part of your exam, followed by pharmacology, followed by what? Physiological adaptation, followed by safety and infection control, followed by reduction of risk. Now, if you follow this approach, you will find out that you will beat the exam. Because when I saw your test reports, right, I can easily tell what made you fail the NCLEX exam. Now, let's do the calculation together. You had near the passing standard in management of care. Safety
Yeah.
and infection control, you have near the passing standard, right? Health promotion, you have near the passing standard. Your psychosocial integrity, you have what? Near the passing standard. Your basic care and comfort, near the
Yeah.
passing standard, right? Your pharmacology, you are near the passing standard, right? Your physiological adaptation, you have near the passing standard. Your reduction of this, you have what? Near the passing standard. So everything you had was all near the passing standard. Now, let me give you an overview of how near the passing standards look like on the NCLEX exam, so that you can be able to understand what near the passing standard means.
Yeah.
Let me try to expand the screen a bit. Let me give you an overview. Now, NCLEX passing standard is 0.00 logits. So let's put 0.00 right here. Right. Now, near the passing standard will be somewhere around here. So near is here, below is here, and then above. Now, so if your question is starting here, if you at the end of it 5 question, if you are up like this, then you are above. Right? But if you are down like this, then you are within the near the passing standard. If you are below like this, then you are below the passing standard. So when you end up your exam at what 150 question, you were in this area. So you were not above the passing standard. I said you were just near. So you were near this passing standard, because this is the passing standard. The passing standard was 0.00, right? You were not above it and you were not below the standard, because below there's a set range for below, there's a set range for near, and there's a set range for above. Do you understand what I'm saying? All right. So that is near. So it means that if you have or near in your NCLEX exam, that cannot help you to pass. So while you can have below, while you can have near, because yes, you can definitely still have near in your test plan. You can have near, you can have below, but your above should be more that so that it can boost what everything that you are scoring, right? So that you can be above the passing standard. That's the main reason why I pay attention to the biggest area that gives you 73% of the exam. Now, these are the content, right? These are the content. Now, this is the concept I'm saying NCLEX is testing. These are the concept of caring, clinical judgment, communication and documentation, culture and spirituality, nursing process, teaching and learning. Now, let me just throw this out there. Do you saw on your NCLEX exam, you saw question that said you are teaching something something. You saw question like that on the NCLEX exam, right?
Yeah, a lot of teaching in a program teaching, like,
Staff education program. All right.
yeah,
That
staff education
this is
program,
what
a
the
lot
NCLEX
of
is testing.
those.
Okay, this is the concept. I'm trying to put that out there because you can never escape questions like that. Right. Because this is the concept NCLEX is trying to test you. Your ability to teach and your ability to learn. Teaching is when you are teaching the client, learning is when you are attending staff education program. Right. So that is your ability. So NCLEX tests you. Your clinical judgment is your case study. You cannot escape it. So all these concepts NCLEX tests you. But a lot of students don't understand what NCLEX is testing. So they go on the NCLEX exam with just random knowledge. They don't even know how to approach the question. If you know how NCLEX wants you to answer caring question, when you go on the NCLEX exam, you will not like have problem. If you understand clinical judgment, when you go on the NCLEX exam, you will not have problem. If you understand communication and documentation, same thing. Culture and spirituality, same thing. Nursing process, same thing. Teaching or learning, same thing. Now, let me ask you another question. You saw a particular question that also said you are preparing a plan of care. Which of the following would you include in the as the intervention? You saw a question like that, right?
Yeah, yes, I did.
Okay, great. So that is your nursing process type of question. So that is the concept NCLEX is testing. Now look at your the content in management of care, content for safety and infection control. That medication you were talking about related to allergy. This is what NCLEX is trying to test. If you can identify allergy, right? Because there are three things you should be able to identify. Is it three things? Let me think about it. Yeah, there are three things. There are some. No, let me just say two things: allergy, and then we have allergy, and we also have well, we have bacterial skin infection, right? So you should be able to differentiate between skin infection and you should be able to differentiate between allergy reaction, right? So, yes. Now, if you said you saw a particular rash, because now that particular time you were saying, oh, you saw a particular rash, I'm trying to like think about it. Because if you
Yeah.
say you saw a particular rash and it's like a dot, something that look like you are describing vesicles. So if you are describing vesicles, maybe NCLEX is asking you which medication are you going to use for that image. Now, if you are describing vesicles, vesicles is what? A bacteria infection. So if NCLEX gave you all antibiotics, it means that NCLEX is not testing you related to maybe NCLEX is maybe because if NCLEX is testing you which of the following medication caused the rash, then I'll be looking for medication related to penicillin. But since you were describing the image and earlier on you said you saw a dot, so it means that the NCLEX is not testing you on allergy because allergy don't have a dot. Allergy have something like map. Allergy is like a map area, like a section that is just going to be red, like this in the skin, around the skin. But vesicles will just be like a pointed dot in the skin of the patient. This is a bacterial what? Infection, right? Because fungal infection as well too is like flakes, but a round area, but it look like a ring kind of way, right? So I will know, okay, I'm looking for anti-fungal medication. But if I'm seeing something like MAP, right, and then the area is red like this, then I'm looking for what? Allergy related what? Medication. Is that medication to solve the allergy or medication that cause allergy? It depends on what you know. I don't really know your question and something like that. So I'm just giving you an idea of the mindset of the examiner. But if I'm seeing
Yeah.
something like vesicle, like dots, then it's testing you on what? Bacterial infection. Bacterial infection, all I just need to look for is the medication on that list related to what? Bacteria. Right, so I'm just going to look for antibacterial medication because that's what will solve it. So NCLEX knows that you need to have the ability to recognize allergy on the skin, fungi on the skin, and bacteria on the skin. Vesicles, bacteria. Ring type is antifungi, or that's fungi, I mean. And then your map type look, that is your allergy. Right, and it will be inflamed. Right, all of them can be red. So yes, that is it. Now, that's what I'm just trying to like think. But your question is, I know 100% is surrounding any of the three thinking I'm thinking right now. So yes, so that is it. Now look at the every content have what the NCLEX is going to test. So you cannot go on the NCLEX exam this time around and say you don't even know what the NCLEX is testing. Now, the next thing is to now understand how the NCLEX writes the question and then be able to break down each question, right? So that is how you approach the NCLEX and you are able to pass. And that's the main reason why, in order to help students pass the NCLEX exam, I created the program, 8 weeks program that give you what? 4 weeks of content,
Okay.
right? You get 4 weeks of content. Then next 2 weeks, you do what? Questions, right? And the last 2 weeks, you do strategy. Right. So the first 4 weeks, when you are done with the content, I start asking you question every day for 2 weeks. Now I expect you to meet what 60 to 90% pass rate right here. Now, if you meet 60 to 90% pass rate, I believe you have the ability to use content to pass the NCLEX exam. But I want to like help you out so that at least the chance of you passing the NCLEX exam will be very high by giving you strategy. Now, at this point, I expect your pass rate to increase, right, to 75 to 95%. Right. Right from here, you might be achieving 80% pass rate, but it should be between 60 to 90. So yeah, as well, so I don't expect it to drop. I expect it to also be between 75 to 95. Right. So if you achieve this, I can 100% guarantee you that you are ready to take the NCLEX exam and you will pass. Right. So this is how the program work, and we definitely, once you can go through it all throughout the 60 days, I can guarantee you're going to pass. I've been doing this for the past 2 years, help 700 plus students pass the exam, and you are going to be part of that number. So the coaching investment price is $497. Most students pay that in full, and some pay using payment plan whereby they pay 250, and then now and then later they can tell me, oh, they are paying this also time.
That's
And
American dollar.
yes,